Yeah, I got it.
Oh,
Sam,
man.
you're doing it. So
All right, we'll double fail safe.
do you want me to try to record it too?
Yeah, if you wouldn't mind, because there's a conflict going on on my normal recording software.
Okay, well, I think I've got it. It says it's recording, but I can't tell that's me or you.
All right.
But we'll go ahead. I think everybody here knows Mike, and we appreciate him coming back. I'm disappointed we don't have more people. I guess the people, would you shut that door, Julius, please? I guess the people who are not here don't think they need it, his services, but they may be surprised. So we'll record it and try to make it available to them.
Thanks. And it's the kind of thing, kind of like taxes. Everybody waits till the last minute. They hate writing those checks. So
yeah, we'll
I
probably
understand.
have somebody join in.
Yeah.
So, do you want to wait a little while?
No,
Okay,
I
here's
can't.
Ryan Bell.
Go.
Yeah, you know Ryan. I think you.
Yeah.
Also.
Hey, Ryan. No, he's remote there.
Yeah, let him. Ryan, good morning. We're just getting started, so say hello to Mike.
Hey, Ryan, how you doing?
Okay. Yeah, there'll probably be another one or two pop in.
Oh, yeah.
I don't think I've ever seen Ryan live. It's nice to see you, Ryan.
Ryan looks like he lost a bunch of weight like me.
I did.
The hard way.
Oh, yeah, me too. Yeah.
I'm doing it slowly. I've lost 20 pounds since July, so I just staying with it.
Ryan's fighting to come back.
Yeah.
Ryan, how's the health?
For the most part, it's good. I just
That's
had
good.
some doctor's appointments and getting listed. That's what last Tuesday was all about. Sorry, I couldn't make it last Tuesday.
Okay.
Good to see you, Foster.
Good to see you as always, Ryan.
Okay. Let's
We're
go
good
ahead.
looking now. We lost weight.
We get started.
I found what y'all lost.
Oh, no.
I lost 80 pounds like 7 years ago.
Oh my
Wow.
God.
Good for you, man. All
I
right.
know I've kept it all off. I weigh less now than when I weigh a little bit less now than I did 7 years ago after all that weight loss.
Wow.
Well, I'm down about 40.
Wow, that's a lot.
Yeah, that's a lot. I've got, well, I was down about 20. I might have gained about 5 back already.
Funny
Yeah.
thing is, the doctor's like, "Oh, I can still get some more."
About a year ago, I had gotten down 25, and that it hit a plateau. I just can't get it any lower. I keep trying, and I got to watch it or it go back up.
If I watch a
feel your
food
pain.
commercial, I'll gain a couple.
Yeah, looking at food. All right, so I'm going to share a screen here.
Okay.
Yeah, just got to find the right one. Okay, you guys see my screen?
Oh, hi, Matt.
Yeah.
All right. If you have trouble hearing me, let me know. It says low system resources may affect your audio quality. So
Yeah, that's telling you your computer is working hard. It doesn't have enough resources. Just wait till you get to Windows 11.
this computer will never get there.
You got a nice big screen where I can see it. That's awesome.
Good. All right, so thank you guys for being here. I so look forward to this, and whatever I do during the year, and what my path to becoming what I do today. Um, it's all about trying to pay it forward. You can do okay in this kind of a business, but I make it kind of like a lot of you guys here. You have a passion for service, and I really feel comfortable in my own skin that I'm able to provide advice on insurance. I would have never thought in a million years that this is what I end up doing and would be passionate about it. But I look at it as my obligation to really help people try to decipher through this. I'm focused. I do a lot of different things, but I'm really focused in individual and group health and alternatives, whether it's Christian healthcare sharing ministry programs or other ways to reduce risk and improve access to healthcare. And I've been doing this now. I got off the corporate path about 20 years ago. It took a year to figure out what I wanted to do, and then I got an insurance license, and I really, it just resonated really well with me. I study real hard. I was telling Mike earlier, I'm now there are over 30, I think it's like 32 individual insurance companies in just the Medicare space that I'm now licensed and appointed to represent Texas. About as many in Oklahoma, or at least percentage-wise, there aren't as many here in Texas, in Oklahoma, and 13 other states. And my advice is no cost. I'm a commission-only guy. You have the benefit of professional advice and support throughout the year. And this is my way of serving. Now, this has been in addition to the pandemic, and boy, what a topsy-turvy year this has been. There has been a continuous change. And, when the administration changed in January, there's just a whole series of programs that were put in place. Everything from the ARPA Act to extra premium subsidies, free COBRA, the infrastructure bill is still rattling around, but for this year, anybody that received a dime's worth of unemployment income is eligible for the maximum premium tax credit for 2021, and regardless of income. So I've had clients that made a whole lot of money, more than I've made in a number of years combined, but that were eligible for free COBRA. And I don't make judgment, because their cost of living is, their overhead is high, and it benefited them. There's also some new things that have been announced even since presenting to Frisco Connect last month about this time, that there will be monthly special enrollment periods for unemployed next year. And I'll get into that in a minute. And you're going to see a number of things between the social welfare bill and the infrastructure bill. There's a number of things that are going to impact healthcare. And there really isn't much that the opposition can do to stop it or to derail it. Now, this unemployment subsidy I was talking about, so far that has not been announced to be increased or to be extended for next year, but it wouldn't surprise me if it does, because we're still feeling the impact of COVID. The extra premium tax credits that were part of the ARPA Act that was approved in February, they're going to continue through next year. Unless the unemployment tax income tax, the unemployment tax credit is announced, which maybe it's kind of like it kind of reminds me of the old Macy's one-day sales, when there would be surprise announcements that actually were surprises. That's been the experience this year. It'll probably be maybe not as frequent this year, but we can expect continued surprises from Center for Medicare Services and from Washington. Open enrollment period. One other thing here, that the open enrollment period for people under 65 get coverage through the Affordable Care Act has been extended. Actually now, as opposed, it's actually starting in just a couple of weeks, and it's going to go through January 15th. You will have to apply by December 15th for coverage beginning December 1st. But if you can actually enroll in a plan through January 15th for coverage for February 1st. And if your income is within a certain range, then there will be a special enrollment period. There will be many people that are maybe have had in 2021 have had substantial income, but as a result of job loss or reduction hours, they're going to be eligible to pretty much sign up for coverage throughout the year. Now, this is my best guess at what those numbers look like. And this is, if you want to screenshot this is the one you want to look at, because the way the legislation has been and everything has been laid out, if your income is at 150% of the federal poverty level, and those numbers haven't been released yet, you'll be eligible for a monthly enrollment period to a special enrollment period. So right now, for this year, in 2020, and I'm just going to use an individual, for a single person. That number in 2020 was 12,760. This year, it's 12,880. So, this is my best estimate. So if somebody is unemployed and they're in 2021, especially early 2021, and they don't qualify and they don't have income, and they have a minimum income estimate of this amount, maximum income of this amount, they're going to be eligible for substantial an ability to get affordable health care monthly. So as people roll off of unemployment or roll off of employer plans, this will be a decent option and much more affordable than COBRA. Also, really important, we've got a midterm election in November next year that is going to be crucial. And this is a bill that is winding its way through Congress. There is the Improving Medicare Coverage Act that would expand coverage to at least 23 million people. And that's at age 60. If it gets extended to 55 or 50, which are other alternatives that may happen, that could be another 40 or 50 million. So the people, as you know, the people that are, let's say gray hairs like myself, they're the first to go and the last to get hired in a lot of cases, okay? So this will do a couple of things. First of all, if and when, it's highly likely that some form of this will pass, this will lead to a number of people now being eligible for Medicare, which is a great deal, whether it's a Medicare Advantage plan or a Medicare supplement plan. Being eligible for Medicare does not only provide affordable coverage and access to more doctors and better coverage than you probably had in an employer plan for some time at an affordable at a much more affordable cost. The unintended consequence, or maybe it's an intended consequence, is that the hospitals and health systems don't make nearly as much money on Medicare recipients. So guess where all that extra cost is going to land? It's going to land on employer health plans. So if this is passed, and it's looking like some form of this will, what will happen is that employer health plans are going to be they're going to see increases. because hospitals will charge more, doctors will charge more for employer health plans. It will also mean for job seekers more freedom and independence, because they'll be able to carry, there'll be more people able to carry affordable health care on their own and not be reliant on staying with an employer that they hate, going into work every day because they need the benefits for themselves or family members. So at least 23 million at age 60, could be 40 million or more at 55 or 60. And at any point, have me, ask questions. Affordable Care Act. This is being talked about now, like any state that did not expand Medicare, which I believe there's 23 of them, including Texas and Oklahoma. This is the Washington is now talking about providing some kind of subsidy at the federal level for states like Texas. Also, something that will have an impact is adding dental and vision coverage to Medicare. This is probably the first thing to be passed and is going to be in the infrastructure bill that is close to being approved. Additional changes. I mentioned the premium tax credits, special enrollment periods. This may come back. Hospitals are now going to finally be, they've resisted it, but they weren't ready for it, but they're now going to be required or face significant penalties, post prices for procedures. There is and if you're interested, there's a company in Oklahoma called the Surgery Center of Oklahoma in Oklahoma City. They have a menu and they are great. They have very high quality scores. They're kind of like the poster child. I suggest you Google them, check them out. If you know people that need a knee surgery and don't have access to coverage through an employer plan or individual plan, or even if they do, they should check the prices at Surgery Center of Oklahoma. This is going to be a big portion of what happens before the midterm election. And because of the Senate and House Democratic majority, it really can't be derailed through the budget reconciliation process and the midterm elections. This is going to happen, or some portion of it will. Now, this was what occurred previously. The other thing was the free Cobra offer. This could well be extended into next year. And so just don't be surprised if you have Macy's one-day sales from healthcare.gov or from medicare.gov. Some other things. Insurance companies are starting to charge for COVID testing and treatment in late already this year. And the reason being that, for most of 2020 and early 2021, that people, doctors' offices were closed. So insurance companies were taking in a lot of premiums and they have to spend it. So what they did was, or they have to give it back to their members, their policyholders. So rather than giving a break to the policyholders, they offered, and this is okay, as far as keeping people healthy. COVID testing and treatment for much of last year was at low cost or no cost. Other things that are pandemic related, if you were trying to get in to see a specialist this year, I recommend you, if you think you're going to need to see a specialist, you may already be too late to book an appointment. There were so many Americans that did not or could not see a specialist for a chronic condition last year or surgery. It's now coming to roost. You have misdiagnosis of significant diseases, and people just catching up. So I recommend that you try to get in to see a specialist if you haven't. This is a policy issue. Okay, there is a possibility that insurers will pay higher insurance premiums for the unvaccinated. And there's also the likelihood of life insurance. This has already started. The additional risk of COVID exposure, if you're a long-termer, you can expect to pay more as a result of your medical history if you go for life insurance. Now, this is going, and Foster can probably speak to this. This is going to really be interesting to watch on the sideline, because HR and employers who want employees to come back to office, well, national companies with presences in every city, every major city, like let's say Wells Fargo, and they can't, as much as they'd like to have everybody back in the office, that's going to vary from their headquarters in San Francisco to Dallas, Texas. Talk about a difference. This is at some point going to really test, and it probably end up a good portion of us will work remotely, you know, continuously into the future. Another thing, and this is really good, I'm happy to see this. The star rating system has been used by Center for Medicare Services for 20 years, that rates each insurance plan on a number of quality scores. It has not been implemented in Affordable Care Act plans, but this is going to hold providers and insurers accountable on a quality basis, because people take note of the simple 5-star system, and there are negative consequences as far as what insurers and hospitals get measured on in terms of how much money they get from Uncle Sam. Another thing, this No Surprises Act. We talked about it earlier, the out-of-network billing, where you get these surprise bills from providers. This has been delayed, a lot of lobbying against it. Well, this goes into effect in January, and it's still not perfect, but it's going to provide federal consumer protection from, let's say, the so-called urgent care centers that will say, yeah, we'll take your insurance. What they really mean is that they'll just process it, but they're out of network. So that kind of abuse will be stopped. Okay, moving on to Affordable Care Act. You've got 3 new companies, Bright Health, Aetna, and United Healthcare, providing new competition in plans at healthcare.gov for people under 65. And you also have other insurance companies expanding in other states, but also they're increasing the number of counties. So, these will be in North Texas, but let's say places like Weatherford or Ellis County or Bahar, or more rural areas, they're now going to see expanded options, which leads to competition, which is good. And you're seeing the same increase in Medicare. Number of companies, I can attest to that are expanding their footprint throughout Texas and other states. I will tell you that this has to do with plans through the Affordable Care Act. The 3 largest health insurance companies in the state of Texas will be offering multiple provider networks in 2022 in order to reach lower price points. Now, at renewal time, you have healthcare inflation. There's nothing that, regardless of the government subsidy, there's nothing being done to really stop medical inflation. And we're all getting older and sicker and that kind of thing too. But at renewal time, insurance companies are going to downgrade members, policyholders, at renewal to a narrower network and or from EPO, exclusive provider organization, where you don't need a referral from a primary care physician, to an HMO network. And to give you an example, Blue Cross has it is the largest. They have a specific network where you have to go to a particular clinic for all your primary care, and only, and they make the referrals to the specialist if you need it. So they're doing everything they can to narrow the, yes, sir.
You froze for a minute. I don't know if that was us or you. Did the other people have him freeze? No, it was just us then. Keep going.
Okay, well, this is gonna be really confusing. And, you know, unfortunately, people shop on price. And 95% of people don't know the difference between a narrow network or a broad network, or a PPO network, or an APO network, or an HMO network. And just say that if you shop on healthcare.gov, then they're just looking for, hey, what can I, you know, what is it going to cost me? And boom, you're going to miss the nuances and differences between one company and another's health plan, especially if you do any kind of a travel. So I'm going to go to another screen here. I have some lucid charts to go through every available healthcare option and decision-making process. And if you're interested in a copy of these, just email me. This says Frisco Connect, but just email me at mpchapman. Here's my email address down. You'll see it at the end. But include your cell phone number and your home zip code, and I can get back to you real quickly. There are a number of options that people don't necessarily know. So I'm going to now do a new share here and bring some of those up. Okay, let's see, where are we? Sorry, guys. Let's do for healthcare. You'll see them in a minute here. And this is a good exercise for, here we go. Let's see which one comes up. All right, this is the simplistic one. This is let's go to single person. All right, I can relate to that. This is a decision-making matrix. And the things you have to consider. If it's just you, there is no unbundling, but for a couple or a family, you should look at each individual differently. You may have one person with a chronic, expensive, potentially life-threatening, maybe physical, mental, emotional health issue, and the other person is healthy as divorce. I'd say that's usually the case. Then you do have to consider what's best for each person. I refer to that as unbundling. But for single person, just to simplify it for the sake of time, the first thing is, are you under or over age 65, right? Because there are major, huge differences. Now, if you're unemployed or 1099, that's the next issue. If you're employed, your employer may offer a group health plan. And if that plan meets minimum value and minimum essential coverage, then you're not eligible for premium tax credit through healthcare.gov. But if it is less than minimum value and they don't offer a MEC plan, a minimum essential coverage, then you have other options. You can select a plan from the Affordable Care Act. It covers any and all pre-existing conditions, as well as mental and emotional health and wellness benefits. You may, if you're terminated, have the option of COBRA, or if you work for a company with less than 20 employees, the equivalent of 6 months of state continuation. If you're somewhere like right now, you've got 2 months, 2.5 months till the end of the year, short-term health plan may be your only option as long as you're under age 64. Not in Texas, but as close as Arkansas, you may be eligible for Medicaid. You have a lot of what I refer to as bad apples offering what are fixed fixed dollar amount indemnity plans that are pushed as an alternative that leave you highly, usually you don't save very much money, but you sure leave yourself exposed to more risk. And then you can also, and I do a number of these every year, if you are self-employed, you have one person with a different last name, can't be a spouse, you can actually set up a group health plan that if you're not eligible for a premium tax credit due to high income, this is a way to get more, I wouldn't say it's affordable, but less expensive and better coverage than you might paying full amount for a plan through the Affordable Care Act. And then you also, let me tell you, all the plans that are available in Medicare for under 65 or over 65, you step outside of the United States, Canada, whether it's on a cruise or vacation, you need to get yourself some real international health insurance that will cover you in the event, especially during COVID times. That will cover you. And to give you an example, I do a fair amount of international travel, and it'll cost you $100 for 2 weeks. So it's well worth. And if I needed to be careful, it would be well worth it. Yes. Okay, I thought somebody had a question. You also have the option of Christian healthcare sharing ministry programs. All right, it's not insurance, but in many ways, some of the benefits are better than what's available through the Affordable Care Act. And then for those that have served VA or TRICARE. And then the worst possible option is not having any coverage, especially given a pandemic and given the amount of extra subsidies that are available now. Now, I'm going to talk a minute about people that are 65 plus, because there are so many pitfalls. First of all, this is an overview. You have Medicare A and B, and supplemental coverage. Doesn't matter if it's for a Medicare supplement or Medicare Advantage plan. You could, if you're not eligible for A and B, and let's say help people that have parents from Canada, Europe, and India that come to live with them in the United States, and they never sign up for Medicare, okay, because they didn't have a Social Security number. If they're legally present, they can, in fact, help a number of people every year sign up for a plan through the Affordable Care Act. It is not as inexpensive as, say, Medicare, but it's pretty darn good for what it costs. Medicaid is also an option, but not in Texas, okay? Except if you're over 65, if you are, let's see, if you're over 65, if you're a child under the age of 19, and if you're a pregnant mother, you're eligible for Medicaid in Texas. So if your income is less than about $12,000 and assets about the same, then you are eligible for Medicaid in Texas. However, here is the issue. I have so many people every year that signed up when or age 65, weren't told otherwise because they received a COBRA election from their employer. Well, at age 65, COBRA is not an option. So if you are age 65 and you accidentally sign up for COBRA, or maybe you were notified, and like everything else you get about insurance that goes in a circular file. If you sign up for COBRA instead of Medicare at age 65, at least Medicare Part A, then you are leaving yourself with big trouble. First of all, penalties that'll last a lifetime. You'll pay more for Medicare. You will also only be able to enroll in Medicare in January through March, and then the coverage won't go into effect until the following July. And any expenses during that period of time under COBRA, guess who's going to pay for that? So you leave a huge risk if you accidentally or just from not knowing any better if you sign up for Cobra. So you have a lot of issues here with this, and there's different options in terms of Medicare supplement and blah, blah, blah. I don't want to get into that, but if you don't sign up for coverage or you delay it after 6 months of termination on a group health plan that is at least as good as Medicare, you're stuck with lifelong penalties, delayed enrollment, and if you get sick in that January through July period, you're going to pay for it. And in a pandemic, that is not what you want to do. So there's also some things if you're working for a company, and I know the older you get, the more likely you are to work for a smaller company. If the company has fewer than 20 employees, you may be offered to join their group health plan, but you need to be on Medicare because Medicare is primary for small companies. So you would be responsible for the portion that Medicare should have paid for if you end up signing up for the group health plan instead of Medicare. So that's just an example. I have other decision matrices here for couples and then for families that are somewhat different, but I'm not going to go through them all. There's differences in age here. For instance, if you have children that are in college in another state, they may need to be on a different plan. If they're under age 19, CHIP may be an option. And then what do you do at age 26 when they're no longer able to be on your plan? And also the way the premium tax credits work for healthcare.gov. You may find the way the subsidies are set up now, it will save you a lot of money having your children on your own plan because your household size is higher, which means you qualify for everybody in the family qualifies for a substantial tax credit versus if you had them on a college plan. So that's something that needs to be looked at. The college student plans are excellent coverage, but the way the subsidies are set up now, based on household size and the extra subsidies, it's changed from what it was, say, in 2020. It may at some point balance out, but right now you have to consider that. And then I'll be happy to go through any of this, or anybody is interested. It's busy, but it's laid out everything you need to look at, and then a way of framing a discussion when we talk, so you know what all the options are. I'm going to share something else here. Go back to the screen, and then let's see. I'm going to go back here. So, I do this all the time. It's not trying to make sales. It's trying to serve and help and guide people. The worst thing you can do is waste your time in a job search trying to go through all this. In 5 minutes, I can answer the questions that I will ask the questions to get the information I need. And because of services I subscribe to and years of doing this, having gotten the learning curve down, don't waste your time and take risks trying to do this stuff on your own. This time of year, especially because of open enrollment being right around the corner, and during open enrollment, I may be reading an email at 2 a.m. So it's really best to text me or call me at either of these numbers. I'll receive a text. You can email me the details if you want, but start with a call and text, and I'll respond. I really do pride myself. I learned this early in my career. Try to answer phone calls on the first ring unless you're on the phone call, and I'll respond as quickly as I can. And also, I am still one of the top connected people in LinkedIn in Dallas-Fort Worth, somewhere between 19 and 20,000 connections. And having been a gray-haired guy and quickly becoming a no-hair guy. I have good contacts. If there's anybody that I have a real relationship with that I can introduce you to, I'll be more than happy to do it. Now, you probably know a lot of individuals who've been unemployed due to pandemic or whatever reasons that could benefit from this. So we're recording this, and hopefully this time the connection or the recording will work. Feel free to forward the connection, my contact info. It's no cost for the advice. It's one of the few things I can think of where you're paying for good advice and it doesn't cost anything. It'll save you a whole lot of time. And if you know of people that are, say, age 60, or when this legislation passes, there will be a stampede of people at age 60 or 55 or 50 or whatever who are approaching that age and want to know what to do, forward my contact with them. It's not about trying to make a sale. It's trying to help people make good decisions about the most important thing that gets taken for granted when you have it, and that's your health. So I've got my contact info here. You can go to any of these links, put your information in you want, or look at proposals. I will put this recording once it's completed on my YouTube channel. You can read here, and we'll get Mike as soon as I get this thing rendered. I'll forward it to you and upload it. We can share it with the group. Thanks a lot for your time. I'm here to answer any questions, and thanks for
Okay,
hanging
well,
with.
thanks, Mike. John Allen had the bosses called him, so he had to jump off, but we've know it's free to us, but want to make sure that you get compensated and so on. So I want to understand, I've had questions about how you get paid. Now, people, I'm thinking about my daughter who has trouble making a decision at any one point in time. So if she called you up, she's not going to because she's working, but if she called you up, she would talk to you and say, oh, I got to think about it. And a lot of these plans you could just go up and sign up for. How would she get you to get the credit? Do you have to sign her up, or can she put your name in, or what?
Yeah, either way, I like to keep a roof over my head, but I will help people enroll, and I can enroll someone in a plan through the Affordable Care Act in about 15 minutes through Zoom or by phone, and because I know what questions come next. I can see each screen. I close my eyes, and I'll answer the questions that may be answered wrong. So it saves everybody time, saves me time. I probably enroll more people than not, but there is a number. My NPN number is number 7751382, and say, hey, did anybody help you? You can put in my email address and my NPN number, and that's then I get you pay the same amount regardless, but that's how I get compensated for it.
And if like the next year comes up, because we are coming up on open enrollment, you helped us in the past, and we decided, oh, we're just going to stay with the same one. Does it automatically roll over, or do we have to put your info in again?
It should stay, but I'll reach out and say, hey, look, let's look at what the options are. There's every 6 months there's new options. This year there will be 3 new carriers and all new plans, and it's the kind of thing you need to shop every year. And Medicare, I help hundreds of people shop their Part D plans who have Medicare supplements or Medicare Advantage plans based on the doctors that are important, the benefits they need, and most importantly, the financial risk.
Okay, and anybody else got a question? We'll ask it. There are some plans where they're on Medicare Advantage, basically, where there's nothing out of pocket to the the person being insured.
Mhm.
And then there are other plans where there's, it's usually a nominal fee. What's the big difference in those plans?
Well, you have, the word supplement gets tossed around a lot, but you have a Medicare supplement. And for, let's say for men in Dallas, Fort Worth, between Part B premiums and a Medicare supplement and a prescription drug plan, you can pretty much figure on at age 65 to 68 or 69, you're probably looking at about $300 a month in total cost, right? Which is probably less than you had deducted from your paycheck every month on their employer. But a Medicare supplement plan G, it doesn't matter whether it says United Healthcare on it or Aetna or Cigna or anybody else. But you're going to pay about $300, but your only out-of-pocket medical expense risk for the year is, this year it's $202.50. Next year it may be $205, 2022. So it's you're again $202 to $205 a calendar year out-of-pocket medical expense risk, plus whatever your prescription co-pays are. The alternative to that are Medicare, most Medicare Advantage plans. Medicare Advantage plans have a network of doctors. You will find many, most are HMO plans, so you have to see a primary care physician to get a referral to a specialist. They may have premiums as low as zero because Uncle Sam pays about $4,200 a year to every to insurance company for every Medicare Advantage recipient, and then the Medicare Advantage company manages the health of that individual. You're talking millions of people that they manage the risk within that $4,200. So you have premiums as low as zero for a HMO plan, or maybe like 40 or $50 maximum for a PPO plan. But what the insurance companies don't tell you in all their fancy ads, and if you're like me, you've gotten a ton of junk mail this time of year, you're starting to, or you get robo-dialed and spammed to death because we're getting closer to open enrollment period. What they don't tell you is that the out-of-pocket medical expense risk is, I think the lowest in DFW this year is like $3,600 minimum. If you go in network, all right, and you have an HMO plan, to as high as about $12,000 or $14,000 if you go out of network and with a PPO plan. So you're taking on a whole lot more risk. And what happens every year, that out-of-pocket medical expense risk goes up by about $500 per year. They keep the premiums the same, but you're just taking on a whole lot more risk on the back end. So it's really a trade-off between how much risk, how much you want to pay for, pay more for certain and low risk, couple $100, okay? Or do you want to take the risk of higher out-of-pocket medical expenses, access to fewer doctors, a lot fewer doctors, and pay less in premiums? And unless your premiums, at some point, if you're paying $250 a month, $3,000 a year in premiums, but you're only responsible for a couple $100 in out-of-pocket expense versus paying just for Part B as an employee. You always have to pay that. You're going to pay maybe $180 for a Medicare Advantage plan. There's not that much difference. So you have to look at it from a financial standpoint. How much risk do they want to take? And I can tell you, having had 3 surgeries last year, I'm glad I had a Medicare supplement plan because you're talking a couple $100,000 in medical expenses. And yeah, I paid $300 a month, but I paid $200. It was great. So I'm fortunate to have gotten through that period. First real significant health risk in my life, and it's taught me a whole lot about the value of having access to care. And I can speak with more passion about the importance of Whenever life throws you a curveball, you have the ability to take action and get in to see a doctor quickly, get second opinions, which you may not have with the Medicare Advantage plan. We don't live forever, and pain is no fun. And the fear and the constant reminder of chronic health conditions, it is a mind killer. So being able to get that behind you does so much for you physically, mentally, emotionally, and spiritually. And then you live to fight another day.
So Mike, I have a quick question for you
Yeah,
about my
Joe.
situation. I mean, I happen to be an Army veteran, and I've been using the VA for my health care now for about 10 years or so.
Mhm.
Medicare is coming around the corner like a train really soon.
Mhm.
And what I don't know is how is Medicare going to be? I don't know what to do with my VA healthcare versus Medicare, and I'm just not quite sure what I should be doing or looking for.
Well, are you on TRICARE for life right now?
No, I was just a kid in the Army for 3 years, and I discovered I was eligible for healthcare about 10 years ago while I was between jobs. So I signed up and I still
Mhm.
use it.
Yeah. Pardon me, I can't turn that one off. I thought I could. You have to look at the options. The VA benefits and TRICARE for life for those that get it. The best part of that, to tell you, Joe, is the drug benefit. There are Medicare Advantage plans that enable you that don't have a drug benefit in it, that have other benefits in its place and are lower cost, that allow you to take advantage of the drug benefits as through the VA. But I can tell you that I lost one of my best friends about 10 years ago, about halfway through my agent broker journey, who relied on TRICARE and had heart issues. He just, his heart went, okay. He knew he had issues, but he decided to rely on VA, and he was on a waiting list. So he didn't have the funds. He was a servant leader like Mike. He hosted a group and was really involved in the career search groups, but he was relying on the VA, and he knew that he in his case it was congestive heart failure. One day his ticker went out, so that's a trade-off. You don't want to, if you have medical issues, you can always change during open enrollment, okay, for in the fall, and you should probably sign up for Part A, but don't rely on the VA on its own. Some benefits you'd also be eligible for at no cost, like Part A, and then it's a matter of what do you want to do, and how much risk do you want to take, and how healthy are you, because there are some great surgeons within the VA system. My brother's in charge of women's health in Cleveland for the VA, so I have a glimpse into the stuff behind it. But all us baby boomers are getting older, so those waiting lists are getting longer. Or if you ever need a special procedure, the guys that are the surgeons at the VA may not be the ones that you want to use. So you have that issue too.
But I mean, I have had incredible care from the VA for the last 10 years. I've had 2 strokes.
Mhm.
I've had quadruple heart bypass. I mean, my care has just been outstanding.
Mhm.
So I'm not concerned about the quality of care there. But to get an MAPD plan, you have to have Part A and Part B.
Yes.
So, but Part A, I don't think there's a monthly fee for Part A.
No,
That's just something.
not if you've worked the equivalent of 10 years.
So I'm not worried about that.
Uh-huh.
But I'm just not quite sure what my approach is going to be here come next year when I hit 65. I don't know what I'm going to do. And So anyway, thanks for, you're giving me some thoughts. So thanks.
Yeah, Part B, Joe, by the way, it'll be about $150 next year.
Oh, I mean, I used to sell MAPD
Yeah,
plans, so
you know all that. Yeah,
I know, I'm familiar with those details, but now it's me. I'm
right,
not talking to someone, now it's me. And
right.
it's been a long time since I sold those plans. So I'm trying to put together my thoughts on what I'm planning to do come next year.
Mhm. Yeah, well, MAPD plan, you know, if you pay the $150 for Part B, an MAPD plan will give you the additional options of
Yeah.
hospital health systems. So you just have to keep, and also throughout the country, there's a lot of places where there aren't. Like here in Dallas, there's a great VA system.
Oh, yeah.
You know, but elsewhere not so much.
So when I turn 65, Part A is automatically given to me. I don't have to sign up for it.
You do have
And
to
to get-
sign up for it, but it's
Okay, but
as long as you work 40 quarters or 10 years, no cost.
okay. So what about so let's see here. So I'm eligible on my 65th birthday. So I would sign up for Part A. And do I have to be on Social Security for that to happen?
No,
No.
you sign up, you can start signing up for Part A and or Part B 3 months before your 65th birthday month. And it goes into effect the first of your birthday month.
Okay. So when it comes to Part B, they would be taking that out of my Social Security check, if I recall.
They can, or you can pay by check, or set up an automatic draft.
So Part B, do I have to take that on my 65th birthday, or could I push that out since I really don't need it?
Well, you need to look at it, and it's a consideration. You want to make sure that you have the best options, and the VA benefit is creditable coverage, but you may not, you can't get some of the benefits that are offered in MAPD plans through the VA, if that makes sense.
Oh, it makes I used to sell the stuff, so
Yeah.
I just don't recall a whole lot of details. So
Mhm.
I do recall that I know that some different MAPD plans offer different benefits. So you just got to go through the morass and figure out which one's going to fit for you. So if I don't take on Part B on my 65th birthday, am I going to pay a penalty of some type for my 66th birthday if I sign up then?
No,
Or because I have a creditable health plan with the VA, that's why.
correct.
Okay, good. Okay.
If you have the right, now again, I'd want to find out more about the type of VA coverage you're eligible for, because there are differences.
Well, there's only one type of plan that I'm eligible for from the VA, because I don't have TRICARE. I was simply a kid who joined the Army at 17 and got out at 20. And then when I hit my 50s, I got laid off and discovered that, hey, I could go to the VA and get health care. Went to the VA office in Green Bay, and they signed me up right away. And now I call it rudimentary care because it doesn't include ambulances, doesn't include some
Yeah.
things. It's up to me to get to the VA hospital, not
Right.
any hospital, the VA hospital.
VA hospital.
But but once I'm there, the coverage is just fantastic. I'm
Yeah.
enamored with it.
Yeah, it's
Well,
great. And you risk your life, or a lot of people risk their life. Now, your case, it's harder to get Medicare. I'm sorry, it's harder to get VA care now than it probably was when you signed up in Green Bay 20 years ago,
Yeah,
or whenever it was.
I have friends who are Navy veterans who are selling real estate, and the VA is declining their coverage. I was shocked when I heard that.
Yeah.
I only did 3
Joe-
years. She did 20.
Joe, I would suggest starting to sign up for Medicare 3 months ahead of time. It's a government agency. It takes time sometimes
Oh.
to get things done. trust me.
Well, I mean, I've got until October next year, so I've got plenty of time.
But just do it early so you don't have to worry about it.
Okay,
And like they said, and then you've got to figure out how you're gonna work the two systems whenever you do it.
Yeah, you figure for $150 a month, $1,800 a year, you're going to vastly increase your access to doctors and hospitals. You may not need it right away, but at some point you might.
yeah,
Mike,
I've thought about that.
Well,
Mike, if
and
I remember correctly, you sign up for Medicare Part A at your 65th birthday. If you don't sign up, and it's no cost, but if you don't sign up, then there is a permanent premium penalty from then on for other things. Is that right? There's some penalty associated with late sign up to Part A, and then Part B is the hospital coverage parts and all that sort of stuff, and you can sign up for that much later, depending on what your other insurance coverages and options that you need are. Is that correct?
No.
No. Okay. All right.
You want to
Erase all
sign,
that then.
you have a 7-month window to sign up for A and B. You can stay on A only if you have creditable coverage to an employer, or in Joe's case, VA. Okay.
Yeah.
But you've got 3 months before your first of your 61st birthday month, your birthday month, and 3 months afterwards. After that period of time, you not only sign up, you not only rack up penalties, that'll continue for the rest of your life. For each month, those that you didn't have coverage, they tack on about 1 or 2% of the premium. And that's for both penalties for Part B as a boy and Part D as in drugs.
Oh, okay. Okay.
Now, Part A and B, if you don't sign up for that period of time, let's say you're October, let's say you're in the month of October, and you don't, is your birthday month. Let's say September. Let's say your birthday is in September, and you don't sign up for Medicare by the end of the year, then you can't sign up until the following January. So you can literally go 11 months without any kind of coverage at all. You're responsible for the medical expenses during that period of time, too. And then once you've signed up during that January through March period, the coverage doesn't go into effect till July. So it's a loophole that lobbyists have tried to get rid of that loophole, but there's a lot of people that get trapped by that, or they go into COBRA, like I mentioned earlier. It can, and the other thing is, when you leave an employer's health plan, let's say you sign up for Part A, go on to employer's health plan. When you leave, you've got 60 days to sign up for Medicare. If you sign up for COBRA, you signed up for the wrong thing, and you're going to be racking up those penalties.
So on the delayed enrollment into Part A, even though I have creditable coverage, those penalties will still apply?
Yeah.
Okay, that's good information.
Yeah.
I thought there was something like that going on with your question, Joe, that I was trying to get Mike to cover, and obviously he did prompt the right question. So, okay.
Yeah, it's the penalties, but the penalties are small compared to the potential of let's say you have a stroke or something, Joe,
Sure.
in that period of time, and you could be out a lot of money.
Oh, sure. Well, I mean, for me, those questions were long covered long time ago. So it was, and so some of that stuff I just remembered late and penalties and stuff like that. So
It's
thanks for
mind
clearing
numbing.
me up.
So I think
Mike,
I have
let me
one
give
more.
you
I think I have one more quick follow-up
Go ahead,
question
Joe.
to validate what I'm hearing. So let's assume my birthday is October next year. So October next year, I sign up for Part A, but I don't sign up for Part B because I still have my creditable coverage from the Veterans Administration. Let's assume that 2 years later I sign up for Part B. Am I still going to be paying the penalties on Part B even though I still have creditable coverage?
No, but let's back up
Okay.
a second. Let's back up a second. You said your birthday's in October.
Mhm.
Don't wait till October to sign up for at least Part A.
Oh, I'm
Sign
not
up,
going to do that.
sign up in July. So
Yeah,
that
I
you
mean,
got July, August, September, October 1st, you'd be covered under Part A.
Right, once the window's open, I'll be
Yeah.
walking through it. So
Mike, let me give you a hypothetical for a veteran there
Sure.
that's covered. If he doesn't have Part B and has a stroke and is unconscious, and they take him to not the Veterans Hospital, but somewhere else,
Mhm.
is he then responsible for all those expenses?
It could be, depending upon where he's sent, for one thing. You know, it could be
That's
sent to the triage hospital in that county. And that may be, they may have if the person is without, if the first thing they do is, and they will stabilize somebody, pop a pill in their mouth, probably strychnine or something like that to stabilize, and then release them. Those medical expenses, and you know, and in Dallas and in Fort Worth, we're blessed with really good public hospitals. Parkland and JPS system, they're awesome. They're some of the best in the country. However, the first thing that's going to happen is their accounts receivable department is going to run a credit check. So you will be responsible according to your ability to pay for some money. And if you're destitute, yeah, you may not be responsible for anything. But if you have assets or income, you're going to be paying something for the rest of your life. Now, they may write off a bunch of it through charity care, or you may negotiate something, but it's not like it's going to be free unless you're just flat out broke.
You know, Mike, I have asked that specific question at the VA hospital in Dallas, and I've also asked it at the clinic. And they won't give me a firm answer to that question. Yes, you're covered at this third-party hospital or not. It depends on a lot of different factors.
Yes, it does.
It depends, because I could be covered 100% from the beginning. Like right now, I'm waiting for another heart procedure to be done. And every time I talk to them, they tell me, if you have any symptoms whatsoever, go to the emergency room. We'll take care of it.
They have to say that. Okay, they're required to say it. You want to go the hospital, you know, if you're far away from the triage hospital, they'll send you to a closer hospital, the ambulance drivers, but you could be unconscious. You know, I know guys that have tattoos on their bicep, you know, in the event of an emergency, DNR, or, you know, take me here.
Okay, any
Is
other
that-
questions?
No, anyway.
Mike,
Yeah, right.
I'm 42 years old.
Mhm.
I have private health care right now.
Mhm.
I have end-stage renal disease.
Mhm.
And so I've signed up for Medicare. Am I subject to all of these periods of enrollment and different penalties and stuff like that we're talking about for not enrolling in certain?
Well, a couple of things. After 24 months, let me partially answer a different question. 24 months on Social Security disability income, an individual is automatically eligible for Medicare Advantage plans. And up until this year, Medicare Advantage plans did not cover end-stage renal failure. They now do. So if you have not, and they go back to when you first apply for Social Security disability income. You may not get approved for a year or two, but if you have not, you may well want to do that so that you're eligible for a Medicare Advantage plan at that point. If you have a plan through the Affordable Care Act at age 42, that's going to cover end-stage renal failure. but you may be better served if you can and can qualify for Social Security disability income.
Disability. I don't know if I'm eligible for disability. I probably am, but if I go on the social worker at the kidney place,
Mhm.
was telling me there's some reason to stay away from Medicare Advantage. And I'm not sure what that was, but it's something to do with it disqualifies me from having private insurance or something.
Well, that's a problem. The social worker gave you bad advice because Medicare Advantage plans are private insurance plans. And up until this year, and also a social worker has no business giving insurance advice. She could, her company could be sued. You could sue them for as much as you could get away with if you find a Philadelphia lawyer. You are with Social Security disability income, from the moment that you sign up, count out 24 months, you're eligible for Medicare Advantage plan. And as of this year, January 1st, you're able to be covered under a Medicare Advantage plan. If you were diagnosed, or if you had that conversation in 2020 and she didn't know about the impending change in the laws, she might have been somewhat correct, but she shouldn't have been given advice like that.
This was last Tuesday.
Oh, man.
Not sure.
Okay. I guess that's the reason you ought to talk to the pros every once in a while.
Yeah, it's very confusing.
Yeah.
When I had my transplant back in 2015,
Mhm.
they told me that I had to get on Medicare. So I signed up for Medicare and I had to have it for 36 months
Mhm.
as a supplement. Well, I had a private insurance. I was actually on Cobra, unfortunately. And every single claim was a struggle between the split between the private insurance and the Medicare. And supposedly the laws are clear on who has to pay what when you have both. But I spent hours online with the insurance company, United Healthcare and stuff,
Mhm.
because they were fighting over who was responsible primary and secondary. And that's what I'm going to have to go through again.
Well, we can talk offline on that, but it's you have some other options that maybe weren't discussed with you.
Because like I've said for a few years now, my private insurance is not really a stable situation.
Mhm.
It depends on a 94-year-old woman who's healthy, but when she passes away, there's no Cobra that we know of. There's no private insurance. So
Yeah, from what you just described, you ought to apply for Social Security disability income, and get the meter running. You can always, change your mind, but start the clock ticking.
for the disability,
Yes.
okay, does that hinder my ability to work?
No. Just means
Okay.
you have income due to a disability.
Okay.
Ryan, I think you might want to spend some time with Mike and see if there's something there. Because
Yeah.
I'm sure he's got some questions he needs to ask you that he didn't want to ask right here.
Yeah.
Because my private insurance is $900 a month, and it's got a $5,000 a year deductible.
Mhm.
It hurts.
Yeah, it takes a lot of, you have to generate a lot of revenue after tax to pay that, as opposed to Medicare Advantage plan where you have, say, $4,000 maximum out of pocket and all of your dialysis, everything else covered. and the premium of $0 to $40 a month.
Yeah, I saw
Mike, I'm
the,
gonna stop the recording
Oh,
unless there's
mhm.
something else you want, because I don't want to get all of Ryan's stuff on there.
Yeah.
Okay. All
Yeah,
right,
it's a good idea.
I stopped mine. We'll see what we can do.
All right.
I don't
I'll
know
edit.
if I can edit it or